Hello, I am Dr. Pavan Kumar, consultant cardiac surgeon at Leelavati Hospital. I've been practicing cardiac surgery over last 27 years in various prestigious hospitals in Mumbai. I am very happy to share my knowledge and experience about heart attack disease or coronary artery disease. Today I am sharing my experience and wish to give you some information about most common heart disease, what we call as a heart attack disease or coronary artery disease. What are the signs and symptoms of coronary artery disease? What we call is angina is the chest pain in common parlance. Chest pain on the left side of the chest which is radiating towards left shoulder or left arm. Usually this chest pain is associated with any kind of exercise. Apart from chest pain, person can have a choking sensation, or after meals they can have discomfort, chest discomfort. These are the symptoms of coronary artery disease, or you may be suffering from angina. Now without angina also, if you are diabetic, you can get some symptoms of breathlessness. What you do normal exercise, you don't get breathless, but suddenly one day with the same level of exercise you feel out of breath, short of breath. That is called as breathlessness. This may be related to some kind of heart disease. Now I want to clarify very clearly here what is angina and what is heart attack pain. Angina is also chest pain, heart attack pain is also chest pain, but angina's pain goes away after rest. When you get chest pain, you sit down, take some glass of water, and then this chest pain goes away. That is called as angina. But when this chest pain is continuous with your feet getting cold, you feel shivering, and you get some kind of let's come to the diagnosis. How do you diagnose a heart attack disease or coronary artery blocks? Diagnosis is based on investigations. Normally investigations which are advised to these patients are routine electrocardiogram ECG, then X-ray chest, then we advise them to undergo echocardiography which shows the pumping of the heart muscles, pumping capacity of the heart muscles, and then any defect in the heart valves. And then we advise them to undergo exercise test if their age is less than 65 years. Exercise test is a treadmill on which you are asked to walk or run, and simultaneously we record the ECG. If ECG changes, that means your exercise test is positive. These are the routine investigations which we advise, apart from some biochemical hematological tests like hemoglobin measurement or some homocysteine levels measurement and lipid profile, cholesterol in the blood. These are the common investigations done on which we make a diagnosis of coronary artery disease. So once angiography is done, then we know there are blocks in coronary arteries. What are coronary arteries? Coronary arteries are the vessels which supply blood to the heart muscles. There are 3 coronary arteries, 2 on the left side, 1 on the right side. Left anterior descending and left circumflex artery, and right coronary artery. These are the vessels which are supplying fresh blood, oxygenated blood to heart muscles. Now these coronary arteries also get blocks. Blocks are basically cholesterol deposits which usually happen over the time, and they block the coronary blood supply. When the blocks become higher than 50% obstruction in the lumen of the coronary arteries, they make person symptomatic. What we call is the person feels chest pain on exercise. So that is where we call is a significant coronary artery blocks. When these blocks can be in one vessel, that can be in multiple vessels, and that's where the line of treatment is decided, whether blocks are less than 50% or blocks are above 50% which are significant, whether they are in one vessel, where they are in multiple vessels. Depending upon, we decide the line of treatment. Coronary arteries blocks by cholesterol deposits are usually not removable, but we can reduce their growth and their size by observing proper diet control, proper exercises so that we can limit their progression to certain extent. We can always reduce the fat, or we advise them to take statins, which are fat reducing medications. We can always we give them blood thinners like aspirin or clopidogrel, so that blood remains thin, it doesn't get clotted at the place of obstruction or blocks. And at the same time, we reduce heart rate by certain special medications, so that heart doesn't run faster, beat faster, when we want them to stay at a certain standard heart rate at any given time. So these are the things which help us in tiding over these coronary artery blocks problem. The treatment modalities for coronary artery disease or heart attack disease are fourfold. First is diet and lifestyle management and control of risk factors, control of diabetes and blood pressure. Secondly, medical management, as I told you about the medical management, to keep the blood thin, to keep cholesterol levels in the body lowest, and at the same time to relieve angina, increase the blood flow in the heart by giving certain special medications like nitrates, and reduce the heart rate by giving beta blockers. These are the medical management strategies. Secondly, if the coronary artery blocks are one or two discrete, then usually we advise them to undergo angioplasty or stent implantation. And then if blocks are more than 3 and above 70%, then usually coronary artery bypass surgery is advised. Now I will tell you something about the treatment modalities of coronary artery disease. I told you about medical management. Now the intervention management of coronary artery disease is basically two: angioplasty and coronary artery bypass surgery. In angioplasty, we perform the procedure through hand or through groin, where a wire is pushed in the coronary arteries, and over this wire we push in a very soft, very small balloon across the blocks of the coronary arteries. And once the balloon is pushed across the blocks in the coronary arteries, over which this balloon is inflated, and on the balloon there is a coil, a steel coil, which is placed on the balloon at the block. And then once the balloon is inflated, the coil gets expanded and the block is removed. This is a procedure of angioplasty. That is how we restore the blood supply in the blocked coronary artery. That is angioplasty, stent angioplasty. Now we come to the coronary bypass surgery. In coronary bypass surgery, we bypass the block by using different tubes which are connected beyond block and the great aorta. There are different varieties of coronary artery bypass surgery where we use different conduits of different methodology. One is arterial type of bypass surgery, which is now being practiced as advanced technology, where we use arteries of your own body to bypass those blocks. In a standard coronary bypass surgery, we use the saphenous vein tubes and internal memory artery to bypass those blocks. These are the coronary artery bypass surgery techniques. Nowadays, it is a fashion or fad to watch some videos of exercise being done to keep yourself fit. Suddenly, on one day in the morning, you want to do exercise, get up in the morning and you want to run. Please don't do this without getting your numbers set right or knowing your numbers. What are the important numbers for you? One is your heart rate or pulse, which should be between 70 to 75. Your blood pressure should be right for your age, between 120/70 to 130/80. That should be known to you. You should know your cholesterol level, you should know your hemoglobin level. The basic numbers you should know. Once you know these numbers, then only you should indulge in any kind of adventure of doing exercises or any kind of misadventure, I will call it. Thank you very much. I hope you enjoyed the information and you got the right information about heart attack disease and how to manage heart attack disease and stay fit. Even if you have heart problem, you know how to manage it, and I'm sure with this information your heart will be healthy and happy, and you will always be smiling. Thank you. Please don't follow YouTube and don't follow Dr. Google's advice as far as your heart goes. These advices are generic in nature. We are the doctors. We can identify exact disease, exact risk factors, and we can advise you much better, safer. It is always better to consult your doctor to know your disease and what kind of exercises, what kind of treatment, and what kind of investigations are required for you. Don't try to treat yourself on YouTube or by advice given by Dr. Google on Google search.